Mr. Speaker, we saw on ITV News the other night that nurses are spending their entire shift treating people in car parks because of backed-up ambulances. We know the Prime Minister recognises there's a crisis in our NHS because she wanted to sack the Health Secretary last week, but was too weak to do it.
For your health, Jeremy Corbyn.
Speaker, even more money is being siphoned out of our NHS budgets into private health companies. Even in the Health Secretary's area of Surrey, a clinical commissioning group was forced to pay money to Virgin Care because it did not win a contract. Will the Prime Minister assure patients that in 2018 less NHS money intended for patient care will be feathering the nests of shareholders in private health companies?
Honourable gentleman, first of all on Wales, this government has given more money to the Welsh Government. It is a decision of Labour in Wales to deprioritise funding for the National Health Service in Wales. And on the issue of the private sector and its role in the health service, under which government was it that private access and private use of private sector in the health service increased? No, it wasn't. No, I tell...
Order. Let me order. I say to the Shadow Secretary of State for Health, he too is supposed to be auditioning for something. He's normally a very amiable fellow, but he's gesticulating in a very eccentric fashion. He must calm himself. It's not necessary. It's not good for his image. Prime Minister.
I say to the right honourable gentleman, first of all, we've put more money into Wales, but the Labour government in Wales has decided to deprioritise funding for the National Health Service. And the increase that was seen in private sector companies working in the health service wasn't under the Conservative government, it was under a Labour government of which the right honourable gentleman was a member.
Jeremy Corbyn!
My honourable friend, the Shadow Health Secretary, is auditioning to be Health Secretary, and he shows real passion for our NHS. Mr. Speaker, under this government, Virgin Care got £200 million worth of contracts in the last year alone, 50% up on the year before. Mr. Speaker, the Prime Minister needs to understand that it's her policies that are pushing our NHS into crisis. Tax cuts for the super-rich and big business are paid for, yes, Mr. Speaker, they're paid for by longer waiting lists, ambulance delays, staff shortages and cuts to social care. Creeping privatisation is dragging our NHS down. The Health Secretary, during his occupation of her office to keep his job, said he won't abandon the ship. Isn't that an admission that under his captaincy, the ship is indeed sinking?
This government is putting more money into the National Health Service. We see more doctors in our NHS, more nurses in our NHS, more operations taking place in our NHS, more people being treated in accident and emergency in our NHS. But we can only do that. We can only do that if we have a strong economy. And what would we see from the Labour Party? We've turned the economy round from the recession that the Labour Party left us with. What do we know? What do we know about the Labour Party's economic policies? Well, we were told all about them from the description from the Shadow Education Secretary, who I see is not in her place on the front bench today. I do apologise. I didn't realise, Mr. Speaker, I did not realise the Shadow Education Secretary was herself undergoing medical treatment. I apologise unreservedly for that comment. But I do have to say that she did describe the economic policies of the Labour Party in unparliamentary terms. It did include the word bust, but she did say that the Labour Party's economic policy was high risk. Now that means high risk for taxpayers, high risk for jobs, and high risk for our NHS. And that's a risk we will never let them take.